All right, everyone, welcome back. So, in our previous session, we discussed about how to obtain and maintain your RBT credentialing. So, today we're going to talk a little bit more in depth about the task list that we're going to work through across this course sequence. All right, so to first begin, if you can either follow along with a computer or you can follow along with your PowerPoint sheet, and we're going to be working through the RBT task list summary. So I'm going to show you how to also do this on the computer so that if you want to refer back to the website, you know where to go. So again, we're at our bacb.com website, and I had clicked the About Credentialing link, and we are within our Registered Behavior Technician platform. You're going to go down to where it says obtaining an RBT credential. Okay, then we're going to click here for more information. And then it'll bring up information regarding your eligibility criteria, your age, education, background check, all of that we discussed before. But then it also goes into the RBT competency assessment and task list. So we're going to click that. It comes in a variety of formats in case English is not your first language. Click the link that's appropriate. And it'll bring up a 3-page document that describes the task list. So it says that the task list includes the core tasks that are likely to be performed by behavioral technicians. These tasks are organized into the following areas: measurement, assessment, skill acquisition, behavior reduction, documentation and reporting, and professional conduct and scope of practice. The task list covers tasks that our practicing behavioral technician will perform with some, but probably not all, clients. It is acknowledged that there might be other tasks not listed here that a behavioral technician would be expected to perform by a supervisor. It is the responsibility of the supervisor then to determine which additional tasks the behavioral technician may perform as a function of their competence. All right, so it also serves as a curriculum for the training required by all candidates of the RBT credential. And the training requirements are as follows. Must cover all of the tasks and subtasks within the RBT task list. We talked about this before, the duration needs to be at least 40 hours worth of training on this task list. At least 3 hours of the training must be devoted specifically to the ethics and conduct-based skills within this task list. And you can be instructed about the task list via either an online platform or in person. And it must be completed within a 180-day period. All right, so moving on to the tasks, we'll start off with measurement. Measurement here includes preparing for data collection, implementing continuous measurement procedures, implementing discontinuous measurement procedures, implementing permanent product recording procedures, and entering data and updating graphs. Okay, so this is all about how we collect our data. Depending on where you're working or who you're working with, you're going to use different instruments in order to do this. And so we're going to talk briefly about various types of instruments and different ways that we can collect data. Then we're going to move on to assessment. Assessment is describing the behavior and environment in observable and in measurable terms. Remember, we talked about how in behavioral analysis, we are only interested in studying behavior that we can see and that we can put a number to so that it is measurable. We're going to be able to conduct preference assessments. That means doing assessments with individuals to figure out what things they enjoy, what might be able to use in a teaching session to increase their motivation in order to learn the skills that we're putting forth. Then assist with individual assessment procedures. These might be curriculum-based, developmental, or social skills. So I'm sure you've seen some curriculum-based assessments in schools, or like when you go to college, obviously those are curriculum-based. But then you also might do more things like developmental based, and we'll be talking about some of those specific curriculums when it comes to the ABLS or the VB map that really assess a range of developmental areas. And that helps to inform our practice and pick and choose programs that are going to be put into play for those individuals we might work with. And then assist with functional assessment procedures. So a functional assessment is used to assess exactly why a behavior might be occurring and why it is maintained over time. Why does it keep occurring? Okay. And then from those assessment results, we can inform an FBA or a functional behavioral assessment. And then typically that's what we use to write a behavioral intervention plan for the students. And typically, if you are a registered behavioral technician, you most likely will come across a behavioral intervention plan and or are doing so now and are primarily responsible for implementing it. All right, then we have skill acquisition. Identifying the essential components of a written skill acquisition plan. So this might be a behavioral skill, or it could be more of an academic skill or a developmental skill, such as identifying objects or responding to a social skills question, such as what's your name? And they respond, my name is Lindsay, okay? But we'll teach you how to read one of those sheets because they're written with such structure. Again, remember this is going back to our dimensions of behavioral analysis. They're written in such a way that anyone can pick up a sheet and read it as long as they are trained and they know the behavioral terminology that goes along with that. Does anyone remember what that term is? We'll get into it a little bit more later. But moving forward, we're going to prepare for sessions as required by the skill acquisition plan. So knowing what materials, what your setup looks like, if you're going to be doing more of direct teaching instruction at a table, or if you're going to be doing incidental work or floor time therapy. Use contingencies of reinforcement. This is conditioned, unconditioned reinforcement, continuous, intermittent schedules. So being able to reward individuals for positive behaviors or behaviors that we're looking to increase using a variety of different systems. Implement discrete teaching procedures. Again, that's going back to more of that DTI work and exactly how that looks like in all the steps to that teaching process. Implementing task analyzed chaining procedures. That's when you have a more complex task, such as washing your hands, right? There's a lot of steps that go into that. There's you walk over the sink, you turn on the water, you put your hands under the water, get them wet, get some soap, and the chain goes on. For individuals with disabilities, that is far too many steps, right? So instead we break down all of those steps, teach them incrementally. First, go to the sink. Good, when they get to the sink, then we give them that prompt. Turn on the water, right? Because they can handle those one steps. And then once they figure out all of those steps, then we combine them and teach them the total task sequence. So that's what chaining is. Implementing stimulus control transfer procedures. So that's a very complex and wordy way of bringing the understanding that certain things have labels and that they are the correct labels for things. And that if you correctly label something or identify something, then often you get rewarded from that, whether it's a social reward or just basic understanding from somebody knowing what you're talking about. And it goes a little bit further than that. We'll stop there. But just the idea that a stimulus is everything and anything in the environment, anything that can have a label, okay? And then over time, kids learn, people with disabilities learn that all of those things have names, okay? And that's essentially what stimulus control is. All right, we're gonna go on to implement stimulus fading procedures. So that's when we teach a stimulus or we teach something, and then slowly we might fade out that stimuli to decrease that individual's need to have that visual or auditory, some sort of prompt to help cue them in as to exactly what that is. So for example, you might have the letter A. You're teaching a child the letter A. First, you might start off with a full outline of an A, and you say, what is it? And they say, A, right? Or you say, what makes this sound ah? And you have the visual A. And then once they learn that after a few weeks, they're like, A, good. Then after a few weeks, you break in, well, now I'm going to try to fade this out a little bit. So instead of having the full visual outline, maybe you completely fade it out so it's barely there, but if they need the reminder, they can go back and look, and it's just kind of a shadow of an A. So then you say, what says the sound ah? Hopefully they independently respond. If not, they can look back and get that